Welcome back. Today I am breaking down important tasks from the NEBOSH International Diploma DI2 that you can expect in your exam. This is your essential study guide showing you exactly what examiners test and how many marks each topic carries. Let's get started. 1. Manual handling risk. Assessment, load characteristics beyond weight, environment factors, MAC, assessment tools. 2. Return to work, long-term sickness, worker returning after 6-month back injury, support arrangements. 3. Violence at work, customer assault on rehabilitation worker, risk reduction and trauma support. 4. Thermal environments, glasshouse heat stress, thermal comfort factors, practical controls. 5. Noise exposure and control, calculate daily exposure using ready reckoner, ELV compliance, control at source, path, receiver. 6. Dermatitis management, work-related skin condition from engine oil, evaluate management approach. 7. Hand-arm vibration, have risk assessment advice, exposure, calculations using ready reckoner, health surveillance requirements, have symptoms. 8. Diesel exhaust emissions and ventilation. D. Triple E risk assessment, natural ventilation analysis, LEV system design. 9. Lone working, labor working alone, risk extent and control improvements. 10. PPE, training programs encouraging use, anti-vibration gloves, hearing protection, attenuation calculations. 11. Biological agents, birds and rats. 12. Return to work, mental health, vocational rehabilitation benefits, arrangements for nursing mothers. 13. Manual handling, till approach for moving furniture and equipment between floors. 14. Cleaning chemicals, drain unblocker, SDS interpretation, storage, spillage, exposure scenarios. 15. Alcohol at work, behavioral indicators, testing appropriateness, contractual and practical considerations, policy development. 16. Local exhaust ventilation, LEV. 17. Noise and health surveillance, reasons for audiometry, interpreting audiograms using L108. Appendix 4. Hearing effects, inner ear changes. 18. Sodium hypochlorite handling, risks from changing 5 liters to 20 liters containers, additional control measures. 19. Hand-arm vibration, HAV, estimate vibration exposure for excavation work, accuracy limitations, better assessment methods, risk reduction. 20. Ergonomics, microscope work, poor posture contributors, ill health conditions from repetitive microscope use. 21. Wood dust exposure, respiratory tract deposition, carcinogen considerations, exposure survey design, LEV effectiveness. 22. Noise exposure, exposure calculations and control measures for power tools. 23. Health surveillance, audiometry programs, health questionnaires, purposes of surveillance. 24. Biological agents, BHBV, HBV, exposure routes in healthcare, vaccination, control measures. 25. Manual handling, patient handling, risk assessment in hospital wards. 26. Violence at work, patient aggression in healthcare settings, de-escalation, worker protection. 27. Chemical spillage, cleaning chemical risks, SDS interpretation, spillage management. 28. Hazardous substances, COSHH risk assessment for hospital chemicals. 29. Ionizing radiation, interpreting dosimeter data, understanding exposure variability in radiology. 30. Flour dust exposure, respiratory sensitization, occupational asthma, inhalable dust, exposure assessment. 31. Mental health and well-being, work-related stress identification, primary, secondary, tertiary interventions. 32. Hand-arm vibration, HAV, exposure from industrial mixers, health surveillance, exposure reduction. 33. Thermal environment, heat, heat stress from bakery ovens, physiological effects, control hierarchy.